Atrial fibrillation is the most common heart rhythm disorder seen, particularly in the population as it's aging. Atrial fibrillation, in essence, is a chaotic rhythm disorder, chaotic electrical firing seen in the top chambers of the heart that causes the heart to speed up. Patients usually present with symptoms of palpitations or racing heart. The biggest risk associated with atrial fibrillation is stroke. So if somebody has palpitations, they should seek medical evaluation to determine what the cause of their palpitations is. And if they have atrial fibrillation, their risk of stroke should also be assessed. Atrial fibrillation has a vast array of treatments. Before, going back to say 10 years ago, the treatment really just used to be drug therapy. Now we have procedures available for atrial fibrillation where the possibility of curing atrial fibrillation and not having recurrent atrial fibrillation is possible. This procedure is called an ablation procedure for atrial fibrillation, and we perform that here at Kendall Regional Medical Center. When you come into the hospital, you will be assessed by our nursing staff. The procedure is done under general anesthesia. It is minimally invasive in the sense that we don't open your chest or operate on your heart per se. But we do use catheters that get inserted through the veins and the arteries in the leg, and we approach the heart via those veins and arteries. What we do in the ablation for atrial fibrillation is we electrically disconnect the pulmonary veins, which are structures that are in the left side of the heart. We try to disconnect those veins from the rest of the heart. The blood will still flow through those veins into the heart, but the electrical connection gets severed when you do an ablation procedure. What I mean by ablation procedure is we use a catheter to burn the heart surface to basically create a small area scar that electrically disconnects those veins from the heart. This connection is felt to be the key to developing atrial fibrillation. So after this procedure, you usually recover in a telemetry bed. The majority of the patients are able to go home the next day.